morning. We're gathered on the traditional territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. I'm here today with my colleagues Laurie Sigurdson, Alberta NDP critic for seniors and continuing care, Janet Eremenko, Alberta NDP critic for mental health and addictions, David Shepherd, Alberta NDP MLA for Edmonton City Centre, and our leader, Rachel Notley. Yesterday, the UCP brought forward another piece of legislation to grab more power and centralize more control in the UCP cabinet. This bill will rip apart Alberta's health system and put a Frankenstein system in its place. One that puts Smith and her cabinet in between healthcare providers and everyday Albertans. It also opens the door for privatization in every sector of our healthcare system. When the outline for this plan was leaked in the fall, the identified risks presented to Smith's cabinet included the potential to fragment care delivery and the risk of service disruption or failure. Failure. That's a strong term. That's language that we would not normally be using in a formal presentation, but it's striking. For the government to then carry on with that plan is highly disturbing. Fragmented care puts people's lives at risk. But now, Danielle Smith and Adriana LaGrange are doubling down on a plan regardless of multiple warnings from healthcare professionals. Just like they did when buying off-label Tylenol. This gives the UCP the ability to create the four arms of Smith's new Frankenstein health system, splitting Alberta's health services into primary care, acute care, continuing care, and mental health and addictions. It also gives the health minister the ability to designate sectoral ministers to each of these arms, which just puts more layers of red tape and will shove patients and providers into ineffective and false silos. This will do nothing to improve patient care. It will do nothing to increase supports for frontline healthcare workers. Earlier this week, we stood with a family whose elderly father had been receiving care in the hallway of a hospital for more than 2 weeks. With this new plan, how many sectoral ministers and layers of administrators and management would need to answer for that man's care? More designations of ministers will see changes in our health structures. Even more elevated salaries for UCP MLAs. More deputy ministers, more management, and more administration. But no new doctors, no new nurses, no new paramedics, no new nurse practitioners, no new nurses. Healthcare workers just want to provide the best possible care they can to Albertans. And to do that, they deserve a government who works alongside them, not against them. Sadly, this is par for the course for this UCP government, who have been refusing to consult with the healthcare professionals, municipalities, educators, and Albertans that they are creating this legislation for. To speak more on that, I'll now turn things over to Rachel Notley.
Thank you so much to Luanne and to everybody else here today. You know, the trends that we're seeing from Danielle Smith and the UCP are really quite disturbing. Bill 22, unfortunately, is just one of many pieces of legislation from this Premier that massively concentrates power and control into the UCP cabinet. For instance, this bill gives Danielle Smith and Adriana LaGrange the legislative authority to change the terms and conditions of where people work. And they are bound only by what is termed as the need to provide substantially similar jobs. In no way will healthcare professionals want to come to Alberta for this kind of murky employment opportunity. And this is what's on offer to over 100,000 frontline healthcare employees here in Alberta. This means the shortage of our healthcare workers will actually explode, because no one will come to Alberta if they don't know what the job is. No one will apply for a job if they don't know the terms of employment or even who their employer among these new 4 pillars is. People apply for black and white terms of employment. They don't apply for substantially similar positions. Alberta will struggle to retain those frontline workers as well, and we will be incapable of recruiting more to replace them. And let's be clear, that shortage of frontline healthcare professionals is at the very heart of the crisis that Albertans all across this province have been experiencing in healthcare. In addition, when this plan was first leaked, as Luanne mentioned, health experts warned against the fragmentation and the silos and the chaos and the reduction in care that this plan was going to create. What we see now through this bill is that those warnings were very clearly ignored. And let me be perfectly clear that the idea that Adriana LaGrange is the stopgap savior of the structural fragmentation that's being created is utterly outrageous. LaGrange, and quite frankly, the public servants around her, are personally responsible for the most significant degradation of our public education system over the last 4 years, during her time as education minister, than we've ever seen in this province's history. And as a result, she is no way equipped to combat the structural chaos her legislation is proposing to build here today. This bill also appears to be opening more opportunities for privatization. The more health services agencies the UCP comes up with to deliver services, the more fragmented that delivery will become. This is legislation that slices and dices and crosshatches and carves and fragments public health care, period. It is nothing more than explosions of shards of glass from which the UCP will invite private sector players to carve out their profit margin. What does that mean for Albertans who are looking for care? It's going to cost them greatly. What all of this boils down to is this: Danielle Smith is abdicating her responsibility to serve Albertans and provide them with the quality of public health care that they, their loved ones, their families deserve from their provincial leadership. And instead, she's just grabbing more power for her cabinet. With this, she's abandoning her duty to healthcare and abandoning her duty to Albertans. Thank you, and we'll be happy to take any questions you might have.
All right, thank you, Rachel. Thank you, everyone. We'll now go to questions, and we'll start with any questions in the room. Just state your name and outlet.
Thank you so much for taking my question. It's Jill Anskolsky with CTV News Edmonton. I apologize, it's off topic. It is for Rachel Notley. I'm wanting to ask about the wildfires. You navigated the devastating situation in 2016. I guess what lessons did you learn and take away from that experience, and what are you calling for from the province as we are approaching the situation now?
Well, I mean, as we've, we learned a lot from that experience, and I will say, I mean, we're seeing some good things so far. So good. I think it's good that we're seeing some early evacuations, so that we're not in a situation of having to do a whole bunch of them all at once. And so I applaud that. I'm glad that we're now in a situation where we have pretty clear answers for folks in terms of income replacement and accommodation support. That's also really good. I remain concerned about the overarching investment and commitment to building a forest fire service that is capable of handling all of these fires as they grow across the province. We've raised this issue before. There should be more full-time, year-long employment. There should be earlier recruitment. There should be more training. There should be greater compensation in order to build up that group of folks who are so important to fighting these fires. So that's where we continue to put our focus. But for sure. What we've seen so far in terms of Fort McMurray is encouraging. But let me also say again that on behalf of our whole NDP caucus and quite frankly, people all across the province, our hearts go out to the people of Fort McMurray. We know this is a really difficult time for them. It's bringing back some very, very scary and difficult memories for folks, and our hearts are with them.
Yeah, as a follow-up to that, just wanting to ask about Bill 21. There seems to be quite a bit of confusion around what the legislation actually allows for. The province insisting again today it doesn't give them any more power to take over in a state of local emergency. Instead, it just clarifies and adds transparency. I guess how much is the powers under Bill 21? Are they necessary in this situation? Do you see any value in that?
As I say, so for instance, with when we were dealing with Fort McMurray in 2016, the authority that we had under the legislation then was more than adequate to work collaboratively with the municipality and also to step in and take a lead role where that became necessary. So that authority was there. What we're hearing from municipal leaders is that they are very concerned that the province is going to come in and make decisions for which municipalities are financially responsible, that there's a lack of clarity around that financial responsibility in the new act, and as well that there may be interference around other kinds of public emergencies like health emergencies that become very ideological and politicized. So overall, we've heard from municipal leaders that they wanted to be consulted in a respectful way. And they got no consultation. They got heavy-handed, top-down, condescending, disparaging leadership from a government that claimed in the election to respect them, but clearly do not.
Well, I have you. I'm sorry, Brianna Carson-Smith with Global News. Can we speak about Highway 63 and what your plans were when you were in government? I just don't remember with the alternative and an alternative route out of Fort McMurray.
Well, we had been looking at, I can't remember it was what the number of it was, we'd been looking at a different exit that would have ultimately still looped around to 93. It was, or to 63. It wasn't looking at a completely different direction out. It was just a different exit that looped around and then reconnected with 63 farther south. So we had been looking at that at the time. We didn't get far enough down the road with it, but that had been the focus. Idea of constructing a highway across northern Alberta actually comes with a number of challenges, and they're not dissimilar from the challenges that exist, for instance, between over the fact that there's no highway to Fort Chip right now.
And then for MLA Metz, maybe you can speak to, with this Bill 22, your time in the medical field, having those 4 different silos. How would you see that working for a patient who, say, sees a family doctor that needs to go into acute care and then needs to go into continuing care? What kind of effect will this actually have on a patient?
So I can speak to how valuable it was to pull things together in the past. And that is that by making the system seamless and be all under one system, the system can reallocate resources to where it makes more sense. So rather than having the acute care have a set budget, they can see that if they transfer some of that money into something that prevents care or to long-term care, then they can move the dollars without teams fighting over who owns what. So that's one advantage. And then to an individual, when there's a concern that comes up, everything just gets booted to different people, different pillars. And you want your teams to be working as one team at a certain level. You're going to have people that work within one system, but above that, there's an integration, and the above that shouldn't be at the level of Adriana LaGrange. It has to be very local so that you can move things around and make things changeable, flexible, nimble, which, you know, we always have problems with that anyway. But it's way more nimble if you can pull things together. And other places in this country have been watching what Alberta did by pulling things together, recognizing that, hey, we need to fix this, there's some challenges here and there, but that this was a better system.
And Catherine Gurkowski, Alberta Today. I'm wondering where you're seeing the potential for increased privatization. Is it the creation of these health service delivery organizations, or where is that concern?
Yeah, absolutely. I think that the legislation really invites the delegation of the provision of healthcare to a whole range of organizations, and when you've got different agencies that are then able to, in their own little space, download to new organizations, I think it just it invites the proliferation of smaller and smaller, but yet undoubtedly privately operated providers of care. And so that's the concern. And it's very clear that the door is open for for-profit providers. And this is a government that has very clearly delineated a desire to do that ideologically. And for some reason, they think allocating healthcare dollars to a private corporation's profit margin is a good use of resources. I do not agree with them, but that is their ideological belief. And this legislation allows for many, many more opportunities for that to happen. And because of all these different sectoral organizations with a lack of transparency around the board and a lack of accountability around the boards, I suspect we'll see far more of it.
And you had mentioned some of the labor implications. The government is saying, oh, well, we're going to offer the same pay, same benefits, same collective bargaining units. Everything's going to be the same, and that's guaranteed for 2 years. What do you think is the implication for this lift and shift? Because I know the UNA has challenged this already.
Yes. Well, first of all, let's be clear. They have rewritten the right to severance and the various and sundry collective agreement rights to severance from dismissal on the basis of folks being offered what's referred to as substantially similar positions. So that's different than the same position, especially in healthcare. We've already seen what they've done with respect to moving folks that are not in bargaining units from AHS into Alberta Health. We've seen their terms of conditions of employment reduce, and we've seen them be told that going forward, once the transition is complete, that their terms and conditions will be further reduced. And so if they can do that with non-union folks, and they're writing in the ability to have substantially similar positions, protect them from the obligations they would otherwise have under the collective agreement in terminating positions, then it's concerning. And all of this is happening when we are in a race across the country to recruit and also to retain healthcare workers here in Alberta. That is at the very heart of the crisis we are experiencing right now. And you know, if I'm someone who's gotten a degree in Northern BC or Northern Ontario, I'm looking at this mess here, and I'm not thinking that Alberta is where I'm going to apply next.
Hi, I'm Michelle Belfontaine, CBC. I just wanted to follow up on what Brianna asked about that ring road that was proposed out of Fort McMurray and to connect with 63. What happened? Like, did that die? That idea die when you guys were voted out of government in 2019? Like, can you tell me a little bit about the history of that?
You know,
Do
that's a
remember?
really, really good question, and I have to say that I can't remember. Like, the idea was there. It was on our. We were doing, if I recall correctly, and you know, it's been a while. If I recall correctly, we had put some money aside to do an assessment of the cost and the capacity for that. I'm quite sure that the UCP ran on a platform of building it. I am not sure what happened to it. I mean, they ran on a platform of building a lot of things that kind of went into the ether after 2019. So, but I can't tell you specifically. I'd have to go back and do the research.
But you think there was a feasibility?
I think, yes, I'm pretty sure that we'd authorized a feasibility study around it. I'm just not sure where it ended up. Because it would have been in about 2017 budget that it was starting, and I'm just not sure where it ended up.
All right, we'll just head over to the phones for questions. Just a reminder for those joining us on the phones to use *9, and for those on Zoom to use the raise hand function. Our first question online comes from Mia from Shooting the Breeze. Go ahead, Mia, your line should be open.
The increased government oversight, particularly with health policy direction, is the NDP concerned at all about the future politicization of certain health services?
We are desperately concerned that so many critical healthcare decisions, most of which should be driven by expertise, by evidence, by science, will in fact be made around the UCP cabinet table behind closed doors by a bunch of folks who not only are not qualified to do it, but have actually demonstrated themselves to be less qualified than the average person in that they hold some pretty extremist views around good healthcare policy.
Do you have a follow-up, Mia?
Thank you very much. And are you concerned at all about certain maybe controversial services like abortion and MAID being impacted by this?
Well, we do know that is a concern, and there's no question that if hospital services are offered by a growing number of private organizations or other religiously run organizations, then there's no question that MAID and abortion are issues that we'd be very concerned about. We know that it's already practice at Covenant Health not to provide some of those services, and of course, if the opportunity for that provision grows, then obviously people who are trying to access those services will find their ability to get them reduced. But we'll have to see where that goes in the future. Absolutely.
I'll do another pastor questions in person.
Yeah, thanks for taking another round. Something that the health minister was unable to say is what happens to public health. She says there will be public health, but couldn't tell me where public health inspectors are going to be housed. How concerned are you about that?
Well, again, the fact that they didn't even think about it does worry me because, of course, this is not a government that has demonstrated a particular level of interest in a whole range of public health efforts. So we are concerned that they haven't turned their mind to it. And now, and again, we would want to see that work be governed by experts who had an arm's length relationship with the UCP cabinet specifically, but frankly, any cabinet. And so we're concerned about the future for that. We're also concerned about, the confusion and the delay around continuing care and the many different aspects that are critical to that kind of care as well.
And I'm just wondering, will you be launching any kind of campaigns? Do you have amendments planned? What's the strategy for opposition to this bill?
Well, we're going to be, the very long bill was just made available to us at 3:00 yesterday afternoon, and we've yet to speak with our caucus about it. But in principle, we're very much opposed to it. I'm not 100% sure how amenable this legislation is to amendment because it is so fundamentally bad across the board. But we shall see. We're going to take some time to consult with stakeholders in healthcare and see if they have proposals that they'd like to see us take up on their behalf to try and reduce the scope of the damage as much as possible.
And that's our time today. Thanks, folks.
Thank you.